So I'm going to take a look at, we're going to go through these tabs and the information that is behind these tabs. For my orders and results tab, I'm actually going to switch to a different view just because none of my patients here have any orders and results, so it's a very poor sampling. And in this process, you'll get a look at what status boards look like as well. So this is a status board. This is also a training environment, and it's my emergency department view. But I want to primarily focus on the orders and results tabs right now. I will show you a view of a status board afterwards again, and I will go through the basic columns on one of our inpatient units and some of the alerts and special colors that you see and what they mean. We have two views of the status board. There's one that the staff see on their computer screen, and it is a detailed clinical view. And then when you're on the units, you will also see a couple of TV screens hanging on the walls that also have a status board. But it's a very minimalistic version of it. So that's the one where we primarily use it to see what the alerts are for the patient, what their TLR or isolation status is. Other departments can see who the nurse assigned to that patient is so that it's easier for them to find the person they need to talk to. And so there's two of those views, and we'll look at both of them a little bit later too. So for this one, I'm going to select this patient and I'm going to click on the Orders tab. So orders refers to orders, just like doctor's orders on our paper chart. I'm not sure if I mentioned earlier, but we do not currently use order entry in Prince Albert. So far, the only place in Prince Albert or in Saskatchewan that is using electronic order entry is the emergency department at Royal University Hospital. But that will be expanding. They're just trying to work on it as a provincial project so that when it's rolled out the same across the province and will work the same way. Very big project, so it'll be a while before that actually happens. So now that I've said we don't use order entry, and you're looking at the screen and you're like, yeah, but I see orders on the screen. So you will see lab and diagnostic imaging orders in SCM. They just come here kind of backwards. So because lab and diagnostic imaging systems feed the results back into SCM, they actually have to have an order to hold hands with. We don't just get the results unless they match an order. So the way it works at present is the doctor still writes the order on a piece of paper. We will still transcribe that order onto a requisition that is still a piece of paper. That will get faxed down to lab or DI will pick it up when they do rounds off the unit, and then they take it to their department and they sit down at a computer and enter that order into their electronic systems. So the acute care health record that we use for our charting and patient information flow we call SCM. And we have many, many other electronic systems in the hospital or in healthcare that don't always communicate well with each other. So real techie people actually have to build a new language. So these systems have a language where they can talk to each other. So the lab system is called the Lab Information System, or we gently refer to it as LIS. And the radiology is the Radiology Information System, referred to as RIS. So you got RIS and LIS. And then some of the other ones that are in the hospital is pharmacy has one called BDM. Mental health uses a system called, I'm going to use the acronym because the words are too many, but MHAIS. Long-term care has their own system. Dietary has their own system. And so all of these, oh yeah, and our registration system is called WinKISS. So we have all these different electronic programs or applications, and they all are more useful if they talk to each other. So in the future, when we have electronic order entry, what that will mean is the doctor will actually instead of writing the order on a piece of paper, the order will be generated within SCM, and it'll go directly into the lab information or the radiology information or the pharmacy system. And then information will come back from those systems to SCM. So the only systems that send us information right now are the lab information system, the radiology information system, and our registration system, which is WinKISS. So when lab enters that requisition or order into their lab information system, it shows up in SCM. So there's not a lot of purposes that you will find the orders tab, but there are actually a couple. So the two things, primary things, and the only column that you will really look at within the orders tab is this status column. So when lab or DI enters the requisition into their system, this status will update. And if it's a lab order, it'll say pending, and if it's an X-ray order, it'll say active master order. So if you're wondering, you're looking at the chart and you say, well, I see the doctor ordered this lab test. I wonder, did we send the requisition to lab? Like, have they gotten it already? And before you pick up the phone and call lab, because lab just doesn't really have somebody sitting by the phone all the time and it interrupts their workflows. So just before we call, it's just an extra or it helps them out if we check the status column. So if you see pending or active master order, you know they've got the requisition because they're the ones that entered it into their system. If you're wondering if a test has been done or if the sample's been taken down to the lab, if lab's been up to draw the blood on your patient, you also can come to the orders tab and look at the status again. So if an X-ray has been done, but there's no radiology report yet, the status will say performed, which means that they've done the X-ray. And if a lab has drawn the blood or the sputum or urine samples made it down to the lab department, the status will be updated to specimen received. And then once the tests are completed, it'll say one or more final results received. So for X-ray, that means the radiology report is available, and for lab, it means that the test has been completed. And when that happens, that is also when the flag shows up in your new results column. So the three things that you can find for information on the orders tab right now are whether lab or DI have gotten the requisition in their system, if they have received the specimen or done the X-ray, and when the results are finalized. So it's just a second step or an extra step you can take prior to phoning the lab just to possibly reduce the number of phone calls. The other thing you'll notice when I clicked on the tab is on this left-hand side is something called the options panel. And we'll see that with most of our tabs is the options panel. And the options panel is filters and preferences that I can apply to the tab that I'm clicked on. You also have a whole new row of tab toolbar icons, so functions and shortcuts and filters that apply to the orders tab that we're clicked on as well. Some of these tab toolbar icons do the same thing as some of the things in our options panel. If you don't want to see the options panel, you can click the little arrows and minimize it to the side. The two key points I want to point out about options panel is the top part. You'll have selections, a chart selection, and a date range. And there's default settings so that when you first click on the tab, it will automatically default to these settings. And sometimes they don't meet your needs and you need to adjust them. So for the orders tab, the default settings are chart selection is this chart. And this chart refers to this registration to the hospital. So if they came into the emergency department and then became an inpatient, those are actually two separate charts. They have an emergency department chart and an inpatient chart. So any registration creates a chart. So this chart and then the date range always displays a date from. So it goes, I'm showing orders from this date, and then underneath it there's tiny little gray words that kind of explain what that date means. So in this case it means from the start of this chart. So we're looking at all the orders from the beginning of this chart, so this visit to the hospital. If I want to look back from a previous visit, or maybe see if there were things ordered in the emergency department before they came up onto the unit, I can move to all available charts, and I can change the date range to look back a little farther. So this patient hasn't had any additional orders during their stay to the hospital. So basically, these guys, it's not a good example, but I can go to all available charts. I can look back to a different date range. So if I want to change where my look back time is from, I click on the little arrow by the date range, and then there's a quick pick. I want to look at orders for today, or I want to look at orders from 2 weeks ago, or up to 3 years ago. And if I have a specific date that I'm looking for, I can go to the tab for custom selection and actually pick a specific day off the calendar. Any questions on orders? Okay, we're going to move to the Results tab. So for the Results tab, our tab toolbar has now changed again, meaning its functions linked to the tab I've clicked on, and my Options panel. So default for Results chart selection is all available charts. So on my screen, it would show me results from any visit that the patients had to the hospital. The date range, however, by default is limited to 1 week ago. So what would pop up on the screen in front of me is any results from any visit to the hospital that have been done in the last week. If I want to look back farther than that, I'm going to go to my quick pick, and I can go to the start of this chart. To pick a better sample patient here. The way that my lab results display on the screen is by default set to the trend view. So your display styles are a little bit farther down in your options panel here, and the highlighted one is the current display. So by default, I get a trend view, which means that each test component gets its own line. For the date range that I have selected up here, I would have all the columns for all results that were done within that time limit. And by trend, it means that I would be able to see the trend happening across the screen. The newest one being the first column, older ones being columns going to the right. The lab result displays in the window under the date. If there's a little star within the result tab, it means that there's like an extra comment or some type of history that goes along with that result. If it's outside normal values, it'll be highlighted in red with an arrow indicating whether it is low or it's high. If it is critically outside normal values, it will display double arrows. And if you're wondering how you know what the normal values are, you can just select any specific test, double click on the number, and then you actually get the whole list of tests from that panel, so CBC with complete diff, each of the components that make up that test, the result, and then in the brackets to the right are the normal values. This one that had the little star beside it actually shows a little H, which means that there's a history. It's been updated at some point. I can click on the H just like I clicked on those plus symbols to expand information and review the different entries for that result. Some of the other ways that we can look at lab results are a summary view, which in that case just gives me a calendar and says, okay, on the 22nd, there are hematology results and something in those results is not normal. So I can click on the flag, and then my view actually switches to report by order. So I'm looking at the report how it was ordered or as the order was entered into the lab system. And it gives me basically all the same information, the specific components of the test, the results, and the normal values. If I go back to my trend view, I am actually now missing some of my results here, and you'll see up at the top there is a red filter alert saying some results might not be shown. And that's because if we go back to report or summary view, right now we've just got selected to display the hematology results. The blood bank results and the x-ray results aren't going to show in trend because we've specifically clicked on hematology. So if I want to clear out my result, I'm just going to go click in the top corner where there's nothing selected and now nothing is highlighted, and I go back to my trend and I have all my results. There's also an option to graph the results. So if I click on trend and graph, I still have my trend view up at the top and a graph space on the bottom. So depending what I want to plot on the graph, I just pick that particular test and it will place it on the graph. It'll also indicate the high and low normals as little triangles and then my result. So because I only have one result from any particular test, it doesn't look very interesting on the graph. But if you were following somebody's hemoglobin that had been losing blood and then had a blood transfusion and they're having daily hemoglobins taken, it can be handy to just view it on a graph to sort of really see what's happening in addition to seeing the numbers across the screen. For x-ray results, if I have this little star in here, it means that the x-ray's been taken, but I don't yet have a radiology report. And if I double click on it, I get a window that opens and it's got this little image here. And I always think it looks like a mouse, but it's actually a video camera, and it's what SCM system uses to indicate that there's a digital link. So all of our digital x-rays are stored in a system called PACS in Saskatchewan. And in order to access the images, you normally would need to send in an application and be approved by a manager and get a specific login and username for the PACS system, usually limited to physicians and radiologists and people who really need to view x-rays. However, within SCM, you do have a bridge to view the x-ray for your patient in PACS without having that additional username or login information. I still always throw out a reminder that we only look at the information we need to provide care for the patient, and it's a rare occasion when nurses actually have to look at the x-ray image itself. We're not really trained on how to interpret those anyways, so if you need to, because other pieces are missing and it's urgent and maybe we're inserting a tube and we can't see something right, then it is available. But typically we don't need to access it. What happens when you click on this image is it launches a PACS system and it will launch the x-rays for your patient, or the CT scans or ultrasounds or anything that are done with the digital imaging. And you won't be able to look at any other patients or search for any other patients in PACS. It just links directly to your patient. If the radiology report has been done, then you will have the word medical displaying in the box as well as the star. So if I hover my mouse over the word medical, it actually pops out with my radiologist report. It only stays on the screen for, it feels like 1.2 seconds to me, but I think it might be 5 seconds. And then it disappears and I can never finish reading it in time. So you can double click on the word medical. Now you have that digital image link as well as an expanded text. So when I click on the plus or expand icon, it gives me the radiology report. I can review it at my leisure without it disappearing. And when I'm done, I can close it. So any questions on results? Got our chart selection. By default, it's all available charts and 1 week ago, and the different display views, defaulting to the trend view. All right, we'll move on to patient info. So the patient info tab, I tend to call it a demographics tab. It will have more information in the future, and instead of an options panel on the left-hand side, we now have something called summary views. And when you click on patient info tab, the default highlighted view is health issues. So currently for us in PA, the health issue that is displayed is the admitting diagnosis. And I'm going to return to my other SCM. So visit reason, also known as admitting diagnosis. And this is entered in the registration system. So when the doctor says, admit this patient for this, that is what's entered into the system as their admitting diagnosis. And that's what we see on this screen for health issues. The second piece of information that will also be available under health issues are any infection control alerts. So if the patient has an infection control alert, MRSA positive, Hep C, HIV, there will be another beigeish gray bar that goes across the screen that says infection control alerts, and it will list any of those alerts for the patient as well. The top three pieces in the summary view are in the list here. Alerts, allergies, and comments are currently not functions that we are using in Prince Albert. So there will be no information behind any of those views. Care provider pulls information from our registration system as well, and it will display the admitting, the attending, and the family physician that has been registered or entered into our registration system. Below health issues is also significant events, also not a tool we're using yet in Prince Albert. More to come in the next couple years. So care providers and health issues are the only two that will provide you information in this top box. In the second box, when I go to addresses, phones, and contacts, you will get the contact, address, and phone information that the patient provided to the registration desk. Demographic visit data just breaks the visit down into a slightly different view. And this is also the one where if you're looking for those additional patient identifier numbers, it's where SCM buries them. And I say buried because it's certainly not an easy click and find. So if you're looking for their chart number, which is also referred to as an MRN number, and that is the number where their paper chart is filed in health records, or if you're looking for their provincial health number, their SASC health number card. In SCM, those numbers aren't displayed in the patient header. They're not really easy to find, and this is where you find them. So demographic visit data, far right-hand side of the screen, small little blue word that says details, and then I get more details about the patient's demographic. At the top, there is a link for other names. So if they have other aliases, it will be behind that one. And then the link for other IDs. And this is where those other numbers are. So VHID is the chart number or the MRN. And if a patient had a chart in Shellbrook, you would actually see a row that said SHID or Shellbrook ID, which would be their Shellbrook chart number. The regional ID, which is currently the one SCM uses to link with the patient and is also the one displayed up in the patient header, and then their provincial health number as well. Because we still have paper-based charts on the unit, the labels are put on their chart papers, and those labels also include this chart number and their provincial health number. But this is where they're located within SCM. The financial and employer, no data flows into SCM for that piece of information. And then the visit history. So under the visit history tab or view, there will be a list of all registrations or visits that this patient has had to the hospital, and it looks back as far as 2011. So any registration they've had at the hospital since 2011 will appear on this list. Um, and that can be handy when you're doing an admission and you're trying to find out when the last time they were in the emergency department was, or how many times in the last couple months, or when their last inpatient registration was and the patient can't remember. And I always say, when at my age now, when somebody asks me, so how long ago? And I'll say, oh, I think maybe it was 2 to 3 years ago. It was probably more likely 7 years ago. So space and time seem to disappear at this point. So really the only pieces on here are care providers, health issues, their contact information that they've given the registration system, demographic visit data, which is where you can find their chart number or their Sask Health number, and then their visit history. We don't do any additional data entry into SCM at this point, so ignore the bottom box. So moving on to the Documents tab. This basically is the chart. All the chart notes are here. And when we look at the options panel for documents, it is all available charts. And then if we look at the date range, it is the start of all charts. So any charting done on any visit is basically on display at your fingertips. Looking over to the right-hand side of the screen, you'll see it displays page 1 of 100 documents shown. So each page will display 100 documents. If you want to scroll from one page to the next, we use these arrows at the end of the tab toolbar, and it'll scroll from one page of documents to the next. So now I'm on page 3 of 6. If I would like to only focus on a particular, maybe I'm like, this patient's been admitted for 5 weeks, but there was something on the nursing admission that I wanted to double check. Instead of having to flip through pages and try and find out where the nursing admission assessment was 6 weeks ago, I can move down to the bottom of my options panel where I can search the document by name. So when I type in nursing admission, it now just filters out all just to nursing admission documents. And I can do that with system assessments or progress notes. You do need to know, like, you have to type it in the way it's labeled here. So if I want all my nursing progress notes together, so I can just read through them one after the other. You have to type it in as nursing progress in order for it to filter down to them. The other way to filter documents is by this group by icon in the tab toolbar. And in this case, then I can filter the documents by date, which is default. The newest one is at the top. I can filter them by document name, which then is going to put all the system assessments together, all the progress notes together, all the nursing daily care, and all the admissions. So that's another way to filter documents. If I'm an instructor and I want to review my students' charting, and at this point in Prince Albert, we haven't been using the functionality of a sign off, so our instructors don't have to go in and sign off on all the charting. But if they do want to review the documentation or the charting, you can sort them by author. So that way then you can find, okay, this particular student authored all these documents. And then it makes it a little bit easier to do a quick read through the specific documents that were authored by a student. But by default, sorted by date, newest at the top. If I want to read what's been charted in any of these notes, I'm just going to single click on a note, and then it will display on the right-hand side of my screen. If I double click on it, it will pop out in a standalone window and I can review the note. If I need to print a document, this is also how I would print the document. So I would go here and my print icon is here. From that main screen, there is no print option. We always have to come to the standalone screen for the print option. The preview, or the way we preview a document, is actually a preference. By default, it is set to the right side of the screen, but if there was ever a time where maybe you had a smaller monitor or we were using tablets or laptops, we don't have as much screen space, we might want to change how these previews display. So in our tab toolbar icons, there is an icon that is a piece of paper with a pair of glasses on it. And when you click on that, you can change your preview. So I can change it down to the bottom of the screen, or I can turn the preview off altogether. And in that case, if I clicked on a note, I'm not going to see anything. The monitor sizes at the hospital work really well for a right-sided display, but just so you are aware, you have the choice to change that if you prefer to change it. If I want to print a document, I mentioned before I have to double click on it. If I want to print more than one document, I can. The system will allow me to open up more than one at a time, but I need to select them on my screen. So I would highlight the documents that I want to print, and I do that by using my control key. It will usually let you pick up to 50 documents, which is something that Health Records has to use when they need to print a chart for patient information release. But it's quite slow to do it. So I've picked some documents that I'd like to print to send with this patient when they're going on a transfer. So I'm going to go to my tab toolbar icon for view, and I'm going to view my document details. So now it has opened up all the documents as they're displayed on the left-hand side here. And then I can read them all here, and I can print them all from here. Anytime you see this row of stars going across the screen, it basically indicates where one document ends and another one starts. If I decide after I review this that, oh, actually I don't want to print this first one, I just want the other ones, I can select which ones I want to print or not print from that panel over there. Once I've got the ones selected I want to print, I just use the printer icon up in the corner here. When you're closing out windows in SCM, you want to be very wary of these X's at the top right-hand side of the screen. Some windows open full screen, some only open half size. If you don't see the tab toolbar at the top of your screen, so you don't see those arrows, you don't see the refresh button, then you can click on an X that's in the top right-hand corner to close the window that's open. If you see the tab or the main toolbar anywhere on your screen, then you don't want to click on the X because it will close the whole program, not just the part that you were hoping it would close. Flow sheets. So flow sheets are also a way of documenting. Right now, the only flow sheets we use in PA are vital signs and input and output. For the options panel for flow sheets, the chart selection by default is this chart, and the date range is from 3 days ago. So on your screen, when you first click on the flow sheets tab, you will see any data that's been entered in the last 3 days. It always defaults to the vital sign flow sheet. It's the one we use most commonly. And basically as columns and rows. If you want to look back at a different date range, I can go to all available charts if I want to compare vital signs from this visit to the last visit, or what they were in the emergency department to what they are in the unit. Just a beware alert, when you click on all available charts, a filter alert pops up at the top of the screen and it says it's view only. Now, what does view only mean? View only means that at this point I can only look at information. I can't add any information. So if you've ever done your vital signs on your patient, you come to your chart and you want to add it. We have to build columns in order to add it. And all those icons that would let me add a column are grayed out. So if they're all grayed out, always double check what your chart selection is. In order to enter or add vital signs, the chart selection has to be this chart only. And then that filter alert has disappeared, and these icons to add a column are more active. So I can pick my date range and my chart selection just like with any of the others. I'm not going to spend a lot of time on flow sheets right now because we'll look at them in more detail when we're actually entering the information and going through the workflow that goes along with the flow sheets. Clinical summary. So clinical summary and visit record review, which is the next tab, are actually two different forms of summarizing or pulling a number of pieces of the patient information from the chart into one screen. So clinical summary displays information in tiles, and they're very specifically selected. We don't have much information on the patient right now because we haven't done any charting on them today. And a lot of the information that fills out these tiles comes from our chart notes. So just a quick overview of where this information comes from, and we'll come back and look at this screen again after we have entered some information on the patient. But allergies, we collect those as part of our nursing admission assessment. So those will be displayed after we complete a nursing admission assessment. Vital signs will always display the most recently entered set of vital signs. So, and you'll see the date gives you the value that was taken of the vital signs, and it also tells you what the highest and the lowest has been since this patient's been registered to the hospital. Contact information. When we looked at the patient info tab, contact information was coming out of our registration system, so what they had told the registration clerk. When we look at our clinical tile or clinical summary tile, this contact information actually comes from our nursing admission. So we ask our patients specifically as part of this visit who they'd like to have as their primary contact. And once we've entered that information, it will display in this tile here. Health issues, this is that admitting diagnosis. So the same one we saw under the patient info tab. Past medical history pulls from our nursing admission. Care providers, same information that is in the registration system. Healthcare directives, a piece of this will come from the nursing admission if they have a living will on the chart, and the code status that they have agreed to in the hospital will also be here once we have a doctor's order and we select that status to match the order on our nursing daily care document. Presenting illness, information that we'll pull off the nursing admission assessment. Visit history, this is that same record of all registrations since 2011 that we viewed under the patient info tab. Risk assessments include Braden scale, TLR, and fall risk, and those will come from different documents as we complete them. Isolation also comes from either the nursing admission or the nursing daily care. And then we would have lab or DI results if there were any during this visit to the hospital. So again, just at a glance, the same information is also available in different tabs and in different documents. This just pulls it into a different view in a different format as a summary. The Visit Record Review tab is a summary of the visit. When you click on it, it loads to the visit that you're currently viewing, and it will default to the last 5 days. If you click on Show All Documentation, it will show any information that's been linked to the visit, including primary care physicians, their locations, any changes on the status board, all their lab orders, lab results, radiology orders, and radiology results, any information that pertains to the visit. It basically is a summary of all the other patient information tabs into one singular screen view. So the status board, as I mentioned before, is a tool that is used to communicate visually information about the patient. So the status board we're viewing here is level 6. Level 5 and 6 status boards are identical. Level 4 has some additional columns relating to surgical things and dressings and things like that. But the basic functionality and the basics of how it looks is the same. Information flows or shows up on the status board coming from a few different places. So some information comes right from the registration system. Some information and alerts come from the lab or diagnostic imaging. Some flows onto here from documents where you do your charting, and some of it is manually entered. So when a patient is registered to the unit, the pieces that automatically show up on the status board is the bed they're registered to, their name, their age and gender, their admitting diagnosis, and their attending physician. So those pieces come right from the registration system. And then I'm just going to take a quick view through some of the different columns. The bed column, as I mentioned, when they're registered, they show up in the bed that they were registered to. However, if they're moved to a different location on the unit after they've initially been registered, it's manually changed on the status board by double-clicking in that column. The status column has a few different statuses. We have statuses for an empty bed if a room needs cleaning or isolation cleaning, or if it's out of service. And then we have statuses for when a patient is admitted and statuses for how they are discharged. When they're registered to the unit, they come in with the status of pending, and their nurse column will be empty. So a nurse is not assigned or hasn't picked up the patient assignment yet. When the nurse picks her name off this list as a nurse caring for the patient, it automatically updates the status to treatment in progress, or TIP. Some of the other statuses that you might see and that also generate visual alerts would be if we want the physician to reassess the patient when he's next on the unit. So if there's something we want the physician to review, the status gets updated to MDRA, or physician to reassess, and the physician's name is then highlighted in red. If the discharge order is written, then the status will get updated to a pending discharge, and then the nurse's name is highlighted in green. So these are alerts that are also visible on those TV screens that are hanging on the walls in the hallway. There are two screens when you come off the elevator or stairs. One is for hallway 1 and one is for hallway 2. And then there are also two more up by the nursing station hanging in each hallway that they represent. So if you notice the nurse's name is in green, it's just a heads up. The discharge order has been written by the physician, and you can get all the things ready that you need to finish off the discharge. If the patient's going to be transferred to another hospital, the status will be updated for waiting for transport, and a little ambulance appears beside the patient's name. It doesn't necessarily mean they're going to be transferred by ambulance, but it means they're going to another acute care facility or hospital. Some of the other statuses you might see are waiting unit transfer, they're on a pass, or a pass to discharge. Most of the time, it'll be treatment in progress. When a patient is discharged, the system wants to track how they were discharged or where they were discharged to. So if they were awaiting transport to go to another hospital, when we discharge them, we would be discharging them to acute, so transfer acute. And when we pick a discharge status, a pop-up comes up saying you want to remove the patient from this view, and the answer is always yes, because if they're not on the unit, they shouldn't be on the board. In the patient name column, there's often a number of alerts or symbols that represent things. The star indicates a fall risk. This little stick man here that's kind of glowing red and is glowing yellow, we refer to as itchy, scratchy man, and that indicates the patient has an allergy. If you see a purple ball, it indicates they are a palliative client. Now, the fall risk, when a patient is admitted or registered at the registration desk, right now the system is set up so that the star will automatically display. So we assume and presume and treat them as a fall risk until we assess them differently. You will initially assess the fall risk on your nursing admission. And if they are not a fall risk and you select no on the nursing admission, the star will disappear from that column. It is reviewed every shift on our daily care document. Fall risks can change. They have surgery, they're on higher doses of pain medication, and they may be a fall risk for a couple days. In that case, when we do our daily care document, we change it to a yes, and the star will show up there again. The allergies are collected on our nursing admission. So when we do the nursing admission, if we say yes, there's an allergy, that little itchy, scratchy man will show up. The age and gender comes from registration. The code status is part of our nursing daily care document, and the code status that is displayed on our status board has to match the order that's in the chart. Admitting diagnosis or visit reason comes directly from the registration system. The nurse is a drop-down list. New results, this is the same new results column that you would see on your patient list and would display a flag if there were new results there. Most responsible physician or attending physician, that gets updated in the registration system and then automatically updates on the board if that attending physician changes during their stay. Clinic lists, they're a drop down, they match the clinic that the attending physician is working from. TLR, when I double click on that one, nothing happens. This is another one that comes directly from our charting notes. PCC stands for Patient Care Coordinator, and they are part of our ACAP program, which is the Acute Care Access Program. It's basically our social workers within the hospital, and a lot of their role is linked to helping plan and coordinate discharge for patients. D- status is a countdown of days to our targeted discharge date. So we try to start planning for discharge right from when a patient is admitted so that we know how our bed usage is going to be and when we're going to have available beds. So it is a drop-down list and it changes, has to be updated nightly. When it's day -3 to discharge, then it's green if everything's good to go. The next column, barriers, are linked specifically to barriers to discharge. So this patient above, he's targeted discharge in 2 days, but HOMO2 has to be set up before we can actually meet that target date. So then the color is turned to orange. And the barriers is also a drop-down list. Comments is a free text. And that's just any other type of pertinent communication that you want to be available to all clinicians at a glance that goes in that comments column. Diet is a drop-down list. All of the COVID screening, COVID vaccination, swab columns are all drop-down lists. So double-click and drop down along with the flu vaccine column. The isolation and when they had their last bath are both columns that update from your chart notes. And after we do some charting, we'll come back and take a look at this again. Some of the alerts up here are updated by checkboxes. So the palliative, a patient is on the palliative program, we check off the box in the P column, so P, purple palliative, and that puts the purple ball up there indicating they're on the palliative program. There's a violence screening tool on the units, and if a patient scores high enough to indicate that they have a potential for aggression or violence, then this box gets checked and it puts a alert warning sign up beside their name, which indicates that the patient has a potential for aggression or violence. And these tools are important for ancillaries that come up onto the unit, lab who's coming in to take lab, dietary delivering a tray, therapies, and to do some physiotherapy. They're able to look up on those TV screens and go, oh, the patient in that room could potentially be aggressive. I better go talk to the nurses and see what type of approach I need to use. If a patient passes away and the body is still on the unit and the family is with the patient, we hang a red rose on the door We also hang one with the checkbox up beside the patient's name. And this again is also helpful to the ancillary, so dietary doesn't go in to deliver the tray that was ordered for lunch but is no longer required. So that's kind of status boards in a nutshell. And we'll come back and look at this as we do some charting, just so you sort of get the sense of how things get updated and just as part of our documentation. I'm going to show you what the view on those TV screens looks like, just because there's no identifiable medical information. So this is what those TV screen boards look like. Patient names are initials, nurse names are just first name. All of those icon alerts are still there. What their status is they're able to identify who their primary nurse is. The flag for new results is up there. Who their patient care coordinator that's working with them is there. The targeted discharge date, their diet, what their TLR status is. And then two columns, the code column and their COVID screening column. So they're not identifiable as to what they are. The code on your clinical view says it's DNR or full code. On the public view, it's just a color block in a column that has two dots, and the COVID screening column as well. And you also can see what their isolation status is. If the nurse's name was highlighted in green because the discharge order was written, you would see that. If the physician's name was highlighted in red because they needed to review the patient's information, that would be there too. So it's mostly a sense of alerts and communication where you don't have to find a computer and log on. You're able to see them just by looking up at those TV screens in the hallway. Any questions?